Nick Prevo, RT. I'm going to demonstrate the Avanos Liberator closed suction catheter. Comes in a standard package, just like this. This is a 14 French catheter, and when I open the package, you'll find a couple things. We have flex tubing if you need it. There's also change on stickers. So if it's Monday, I would put this on the Thursday for change on Thursday, as this is a 72-hour closed suction system. The system in itself, 14 French, similar rigidity, PVC, same suction power that you're used to. Nothing really novel about that. But there are some differences between this system and some of the other systems that are out there. This goes on the patient's ET tube right here, and you'll notice that this is a modular system. And so it'll swivel this way. This is where your patient connection would go, and it also swivels here to give you a little bit of increased mobility. Again, nothing novel about this. Still your twist lock, 14 French suction catheter that everybody's used to. Advances the same, has the same feel. We put a blue wedge, not that this is any harder to disconnect than a standard suction system, but if somebody does stick this on there, you have the ability to wedge that in and pop it off. Now, getting a little bit closer with this wedge, there is some questions about this from time to time. It only works if you place the wedge in between the two flanges to get proper leverage. If you try and go above, there's nothing for it to grab onto. So back to the suction catheter and suction system. What separates this from other suction systems on the market is that we added a two-way stopcock. So now you have the ability to open this stopcock and close it to the suction device. This piece up here, the top of the manifold which connects to the circuit, can never be closed. It's a two-way stopcock. It will only turn this direction. So you can never interrupt ventilation. The patient will never stop breathing. But you have the ability to open this up, pass your catheter, just like you normally would. There's centimeter markings on the catheter. You could line them up, pull it back, close your stopcock. So now when you rinse your catheter out, you don't have to worry about any of that saline going back down and causing aspiration in the patient. You also have the ability to be able to disconnect without ever breaking the circuit. So as the patient's ventilating, you never have to worry about de-recruitment or loss of PEEP. This is a very important feature, obviously, with everything going on today. So that being said, the major difference is this two-way stopcock. So if you aren't able to suction, chances are the stopcock's closed. If you can't close the stopcock, chances are it's just pinched. If you forget to close the stopcock, what does that mean? Or how does that affect the patient? Well, nothing detrimental to the patient can happen, but how many times as clinicians have we walked in and seen our catheter migrate down into the patient's airway? If we get in the habit of closing this, we don't have to worry about that airway obstruction ever being possible. The other advantage to this, too, is that it preserves the catheter. We've all walked in a room and seen the sheath on the catheter inflate with air, protects it from moisture, just really helps with the integrity of the catheter overall. So if you forget to close it, nothing will happen to your patient, but if you keep it closed, it just solves a couple of those other problems. So again, with the closed suction catheter, still as a twist lock, so I would untwist it to be able to suction. I can open it up, pass my catheter just like I would any other catheter, pull it back, close this when I'm done, and now I have the ability to rinse it without allowing aspiration. This part of the catheter is good for 72 hours. Your change on date sticker would go here. You can take this off, replace it at the 72-hour mark. The manifold, which makes the system nice too, is good for as long as your vent circuit is good for. So right now, if you aren't changing your vent circuits, but as needed, you don't have to change this manifold, meaning you don't have to break the circuit for routine suction catheter changes. Unless this is visibly soiled, or again, it's time to change that ventilator circuit overall. So another advantage to this system, besides allowing for routine suctioning, is that we have a bronch adapter. And right now, especially with PEEP being a hot topic and de-recruitment being an issue in some of these patients with ARDS, we may avoid doing a bronchoscopy because we don't want to break the circuit to put the adapter in line. Also, every time we break that circuit, we expose everybody at the head of the bed to that mystery bacteria. So we have made a bronch adapter. It comes individually packaged like this with a cap on the bottom. So you can take your suction catheter off, you'd put the cap on, and then you can safely set that down without having to worry about any cross-contamination. You'd put your bronch adapter in line. Now, I never had to break the circuit to do that, so I didn't worry about any recruitment, any loss of PEEP. I can have this open, nothing spraying out. As an RT at the head of the bed, I don't have to put my finger over this. And now I can take my scope, insert it in, or mini BAL, either one, open this up, perform the procedure. When I'm done, I just don't close this all the way. And now I have the ability to pull that out without any de-recruitment. This seal on here also seals tightly up to 40 centimeters of water pressure. So when this is open, as long as your ventilating pressure is below 40, you shouldn't have any loss of tidal volume. When you're done, again, you'd close that, pull the scope out, you'd take this off, throw it in the garbage, and you would go back to your normal suction setup. I hope that this helps.